Hello, and welcome to Rebound Athletics. This time it's on neck problems and upper cross syndrome and how to appropriately rehabilitate that issue. Before we get started, I just wanted to say, like with any other video, if you're having acute problems with your neck, you should see a physician. What we're going to talk about is more posture related, chronic neck conditions, chronic neck discomfort. That's our focus today. But if you're having rapid changes in the condition of your neck, you're having numbness or tingling down your arms or shooting pain down your arms, please see a physician and have an evaluation. Or if you just have any question about your upper body that you're not certain about, see your physician. In our society today, we're having more and more neck problems, actually. And this is because of this phenomenon where we're working at the computer, driving, leaning over, head forward position, also looking down at our devices all the time as we use our phones. This causes a head forward posture where the head is ahead of the shoulders. The ear does not line up with the acromion as it should. This head forward posture could also be from sleeping, because a lot of people sleep with a big pillow under their head that pushes the head forward all night long. You're sleeping on your back. So this head forward posture changes the length of the muscles around the neck and the back and the upper body. Most notably, the muscles that change length, the ones that shorten, are the upper trap, upper trapezius, and the levator scapula, and also the sternocleidomastoid you could put in there as well. In the front of the body, there's tightness of the pectoralis, and all this together tends to elevate the shoulders and roll them in, and that goes along with this head forward posture. And if you're chronically in that position, that starts to be your posture. The second part of that is some muscles lengthen, and those muscles that lengthen are the lower trapezius and the rhomboids, those muscles between the shoulder blades that pull them together. Other part of the muscles that lengthen are the deep neck flexors that pull your chin back or pull your head back. So if you look at the muscles that are tight, the pectoralis, the upper trap and levator, and then you look at the muscles that are loose, the lower trap and the neck flexors, it creates a cross. And this is what Janda talked about in the 1980s as the upper cross syndrome. And this is what we're going to talk about today, and Greg's going to show us how to rehabilitate it. So if you remember our Rebound Athletics principles, we have to take the muscles that are shortened on this axis, and we have to lengthen them to restore the normal resting length of the muscle. And the muscles on this axis which are too stretched out or lengthened and weakened, they need to be reactivated so they can come back to their normal resting length. The other piece I want to mention is that part of our Rebound Athletics principles is also that body segments have different needs of mobile, stable pattern. And we know from our previous videos that the core, the lumbar spine, needs to be stable. The thoracic spine needs to be mobile, and that means that the cervical spine needs to be stable. But if your head is forward and the muscles that surround the upper back and the neck are weakened, that creates a relative instability of your neck. And I believe that, in my opinion, any neck pathology that you may have is going to be accentuated by this position, because now you've unstabilized an area that needs to be stable. So I'm going to throw it over to Greg now, and he's going to show us how to do the first step in rehabilitation. And the first step in rehabilitation, again, is to take the muscles that are tight and shortened and to lengthen them, because we don't want to build any strength on a dysfunctional muscle. And then he'll show us about activating the muscles that are too long. And so at this point, I'm going to turn it over to my partner, Greg Kadishan.
Thanks, John. So we're going to show you how we can resolve the issue of upper cross syndrome. First, we're going to start with manual techniques to lengthen the anterior muscles such as the sternocleidomastoids and the pecs, and then we're going to work on the serratus and also the posterior scapular muscles. The first step in working with someone with an upper cross syndrome is to start with lengthening the sternocleidomastoid muscles. They're the ones that are responsible for that forward head. Now, before you start, I'd like to place the knees in a slightly flexed position to release the pressure from the upper body. And you can use a simple bolster or pillow underneath the knees. This will help the upper thoracic relax more. And then also you want to have the shoulders even with the edge of the surface you're working on. So move forward towards me, okay? Now, I'm gonna support it with one hand. Now, I'm gonna use my thumb and palpate the STMs until I find some tension. And I'm gonna slightly flex, gently, and then extend and rotate. Be careful so you don't press too hard and injure the jugulars, but you want to let the skin slide as you feel a little stretch. Very slow motion, do not drop the head, and then you rotate and extend. I like to perform that 3 or 4 times. By the time you get to the 4th time, maybe even the 5th time, you're gonna feel less tension and improved motion. And this is much better already. So I'm gonna move my thumb back a little posteriorly to get the upper trap and the levator. Same motion, just push in and then gently side bend. All right, and I'll go on a pattern of 1, 2, 3, 4. Get to 4, you feel some tension, and you match the pressure with the stretch. Again, 3 to 4 times. And what you do to one side, you must also do to the other side. Very important. Slightly flex, grab the sternocleidomastoid, extend, and rotate. Repeat that. Little pressure, extend and rotate. And in this case, he's so tight on the side, I can actually feel it sliding under my hand. If that happens, start over. Grab it, squeeze, extend, and rotate. And as you notice, I have his head across on my body. That gives me a better way to control it. So my hand is supporting, and I'm actually giving gentle push to stretch. So now we've increased the length of the sternocleidomastoids and the upper traps. We're going to move down towards the pec. Now the way I've done this is, remember, keep the knees slightly bent. This keeps the thoracic a little more relaxed. I like to grab the patient by the wrist. This gives me control of the entire limb. I'm going to externally rotate, use my thumb, stay relaxed, and to find it'll feel rigid, it'll feel hard, and sometimes, ooh, that hurts. That's where you want to apply gentle pressure. You're going to flex and externally rotate from the wrist, keeping the pressure. You will feel the tension. And you want to repeat that 3 or 4 times and count to yourself. So I'll go on second 4. 1, 2, 3, 4 at that pace. All right, now as I move on to the serratus, I'm going to drop my hand a little lower. It gives me better control. Slightly bend. Feel for some tender spots or nodules or where the patient said they're feeling some pain. I'm going to use my fingers or sometimes my thumb, depending on their size. Pressure downward, externally rotate and flex. This one can be a little painful, so let them guide you as to where you want to stop. When you stop, hold it for 2 or 3 seconds. A tight spot right about here in the serratus. I'm going to flex and push. 1, 2, 3. And I repeat that a few times. 1, 2, 3. Now, Remember, what you do to one side, you must also do to the other side. If the other side is not symptomatic, doesn't have pain, you still want to try it at least one round just to make sure that they're bilaterally equal.